I'm Conroy Lawrence, proud to be Deputy Regional Convener for Unison in London. I'm pleased to be here today to see so many of you standing up to fight for the A&E, or our A&E. Unison is very proud to be part of this campaign. We have spoken to our members, nurses, porters, cleaners, paramedics and health care assistants, many of whom are local residents as well as workers in the hospital. Overwhelmingly, they have told us that their patients and the local community needs this hospital. South London needs this hospital. Closing the A&E is not in the interest of South London. The patients don't want it to close, the doctors and nurses don't want it to close, and the residents don't want it to close. The only people who want this A&E to close is the government. And how many of them would have needed it anyway? None. Local services are already buckling under intense pressure. Earlier this week, Bromley A&E closed and ambulances were diverted to other local hospitals as it was at full capacity. Where those patients will go is anybody's guess. Unison has submitted a lengthy and extensive report to the Trust Special Administrator, an additional report to Jeremy Hunt, which makes a number of compelling arguments to keep the emergency and maternity services open here at Lewisham. There are arguments, and it's just not a wish list. They're not ramblings of do-gooders. They are clear clinical reasons for maintaining services here, proof that the politicians have yet again got it wrong. Let's be clear, this is about money and the government's political ideology. Profit before patients, cash before care, and the NHS moving further and further away from its founding principles. It's true what they say, never trust a Tory with the NHS. Cameron and his Tories will deliver on Thatcher's greatest wish to demolish the NHS. South London Healthcare is paying the price, the PFA loan agreements that we, the staff and patients, users of the hospital, never signed up for. Poor management that none of us ever had any control over. The reintroduction of business into our healthcare and the government's stealth agenda privatise our NHS. There's money to be made at our expense. But this is not that simple. All NHS facilities in South East London are integrated and support each other. They can't just pick and choose the bits to close or sell off to the highest bidder without there being an impact felt by local communities. We know that we need an A&E based in Lewisham. How many gunshot victims or people suffering from heart attack will die in the back of an ambulance on the way to Guy's or King's in central London? One would be too many. David Cameron's memory may be short, but mine isn't. In 2007, he boasted about being willing to go into a bare-knuckled fight to defend 27 A&E departments threatened with closure, which at the time, including Lewisham. So David, here we are again. Where are you? Although, having said that, there's so many people here, I probably missed you in the crowd. Jeremy Hunt, Secretary of State, will make a final decision in the next few days. Today we must send him a message loud and clear that downgrading our hospital isn't an option. We won't stand by and let our NHS and local services be attacked and destroyed. This isn't their hospital, it's ours. Save Lewisham A&E.
Thank you very much.